So we had just started, before we got into having to change the card and everything, we had just started talking about some of the things that you did in your career. I mean, I know that you were, obviously a really good nurse, and that you told a lot about your education and how it started. Are there highlights, real sort of career triumphs, or particular patients that you really, really helped, or things that stand out in your mind as important from that part of your life?
Well, one incident that I had as student nurse was that I was taking care of a man who had kidney failure. And I have a picture of me standing beside his bed that he wanted to have that picture of me. And he declined in health, of course, but wasn't there at the time. But his wife took a picture of me by the bedside in my uniform, which I've got at home, which I'm very proud of, because that was only, actually, other than the graduation picture that we took of. We didn't have cameras at my house, so we didn't really get a chance to do much photography when I was growing up. And so that was important to me. I still have it. And then another thing that I'm very happy about, that I worked those years without ever having been called up for not doing something right or forgetting something. I was very honored to have been the whole career in and out and not made any mistakes that would follow me around.
So the entire time, from beginning to the end of your work years, which was 30 or 40 years, right?
Off and on.
Yeah, you had 100% clean, perfect record. It's fantastic.
I mean, I wasn't called up for anything, and I did a satisfactory job every time I was. And I did float in Mountainside, which I didn't know what floor I'd going to be on until I got to work. And that's when I was doing filling in on preemie nursery. Now, pediatrics, when I did that for even out for 7 years, was 11 to 7 I worked. But I never worked a full week. I always worked 2 to 3 days, or nights, so that I could have time to rest the day between, because I'd go without sleep the whole day. I was going in, and then the next, with just a nap. After Dad got home and I got the kids into bed, I'd take a couple hours nap and then get up and go to work.
Right, because you did the night shift almost all the time.
I did the night shift almost all the time when I was doing in the beginning. And then it was 3 to 11 after the kids were out of, Barbara and Ronnie were, Bob and Roy were out of the picture, and Karen and Patty were home. I would prepare what they wanted to eat in the afternoon, and then they'd come home and serve it to Dad and them, and I'd be going to work at 3 o'clock. And one thing, that I didn't have the car all the time. Dad would drop me off and come and pick me up, and he wanted to do that because he was afraid for me to go into work at 11 o'clock at night and park the car, so he'd take me. Then he'd come and pick me up after the kids went to school. Because I was a conscientious nurse, and I never left anything undone or handed it off to somebody else. So I spent the extra hours, because I would be caring with patients, not at the book work, and end up not having my charting done by 7 a.m.
What is the stuff that you really loved about nursing?
Just helping somebody who needed help. I don't know if it was a glass of water or a new blanket or change the bed or whatever. Everything was important to me. And I used to work with a lot of nurses' aides, and they always liked working with me because I always went with them if there was a job that was a little tedious to do or a little upsetting. I would always try to be there to help them out, And then I got a lot of experience for having floating, because I'd go from surgical to medical to pediatric to intensive care. I worked a few nights in intensive care, but I didn't feel comfortable there, so then I refused to take the call on it, because I couldn't keep up to date with everything that was going on. I'd do one night or two. If there was another RN in charge, I'd help out.
And just because of the change in technology?
Yeah, yeah. And the techniques and everything. But I knew when I was finished nursing after Gary passed away, and I was back on the registry for cases, I did a few 3 to 11 cases in the hospital. But I got an acutely ill patient. She had had spinal surgery, and it was delicate. They were starting the dimmer, all dips, drops where you push the button when you have the paint or don't paint. And I had to ask somebody to set it up for me. And I said, yep, it's time to go. There's new equipment, new stuff that you have to learn. And I'm already 62. I don't really need to press myself with that. And that's when I decided to retire. But I said something to Dad about, one time I made the comment, I said, I'll know when to fold my whites, and I'll do it when it's the timing. But he was so used to me working with Gary, because it was the same thing over and over every day. But he got a little upset when I decided I was going to stop working. And says, right when I need you to be working.
Just because of the financial thing, or?
Yeah, well, we were finally saving something. He wasn't spending it all. So that was a little bit of a scene, but then he apologized. He didn't realize the reason I did it. Finally, he finally understood. I said, it's like you getting a new style of cutting. You're not sure you're going to please the patient or the customer until you've done it. So I had to